Okay, Steve, this is the feedback debrief for simulation 2, but your first simulation of the day for this fortnight. And Sam Smith behind the camera as well as Jack Williams.
Yep.
And we have two of other wonderful CSOs as well in the room. Mate, can you just briefly outline, what did you go to, what was wrong with your patients?
Yeah, so it was query 36 week or below gestation, lady who's give birth to twins. One twin, the first twin required newborn resuscitation as it hadn't transitioned and was in cardiac arrest. The second was fine, transitioned well. The mother had high risk factors in the fact that she had no antenatal care, previous history of PBH requiring transfusion, so otherwise mum and the second twin were relatively well. The first one was in cardiac arrest requiring full resuscitation measures.
Yeah, great. And so you kind of just started to touch on it, I guess. Outline your management.
Yeah, so my initial management, when I had arrived on scene, the first child had been born already. It was about 4 minutes old, and had evidence that it wasn't transitioning. No spontaneous respirations, slow pulse in the twins. So yeah, needed. I went a stepwise approach. Initially ventilating, escalating the ventilation, and then into CPR, and then circling back around to mum. Once I established a supraglottic airway and had a single person CPR, delivered the second child. The second child was transitioning well. Had a conversation with mum about administering oxytocin. She was against that, respected her wishes. Then realised that both of them appeared to be relatively well, and then focus temporary efforts back on the resuscitation of the firstborn. Upgraded, had an IO in already, adrenaline had been given, fluids had been given, and upgraded the supraglottic to an endotracheal tube to establish more effective ventilation, because there was evidence that the SGA wasn't ventilating as well as what we would have liked. And then just second officer had arrived, assessed mum and bub, established that they were still transitioning well, prioritised them back onto running the resuscitation of the child, while I focused my efforts again on making sure that mum and bub were transitioning well, as well as the metrics around the CPR and establishing that we were having regular intervals of adrenaline and reversible causes, trying to correct the reversible cause.
Yeah. Okay, and I guess you kind of outlined there, not just your management, but your justification.
Yeah.
Anything you change?
Yeah, I think common theme is logistically my setup needs finessing. So I think when the cord was still attached, I couldn't put the baby on the floor. Maybe I could have commenced some IPPV in my arm or something like that. That could have been something for consideration, but we clamped the cord. I probably, just through probably the external pressure of the job and its urgency, I I didn't take the time to set up a more sort of robust resuscitation area, so I probably could have established a more logistical sort of pragmatic approach to the resuscitation area. However, I didn't want to be too far from mum because of the high risk factors of her previous pregnancy and birth, as well as the delivery of the second child. So yeah, I think logistically I would have managed things. I think the way I managed the child in cardiac arrest was sound. I think justification for the LMA single person CPR, so I could establish effective ventilation compression, just being time poor resourced, and delegate that to one person while establishing an IA so that I can then administer adrenaline and fluid. I think that allowed me to free up and do that, and then go back and set up a tube, an NGT as well to decompress the stomach. So the management that the child got in cardiac arrest, I think there's not too much I'd change there. It's just probably around the workings. And then probably I could have just, it's a busy job and time poor, but I probably could have established better rapport with the mother, just letting her know how the child was tracking, and just probably establishing antenatal history earlier. But I think they're the main things I can think of.
All right. Thank you. Overall, things did really well. You moved quick on what you needed to. You basically naming it, saying, "Hey, we've got neonatal resus here. Let's cut the cord, your ventilation, switching to your high flow O2, and then transitioning to obviously CPR. You've delivered the baby, tactile stimulation. You've done a good initial assessment. You've verbalized, like, let's keep them warm. I'm left with Dad. Your sit rep came in at about 6 minutes 30, so could have been a little bit early.
Yeah.
But I would say, just with that, I would just put a note there. Just keep it simple.
Yeah.
So you could just say, like, after 1, 2, 3. Twins delivered, one neonatal resus in progress, or just neonatal resus, second crew, and just anecdotally, that's what I often find I'm going to, just because there's so much going on. It's just because you gave her, you're not giving a real detailed sit rep there.
Yeah.
Which is not anything wrong, but you've got your hands full. It's good that you went. I think good justification. Moving from your eye gel, then to your IO, and then before going back to your tube. Ada's arrived. You said, "Hey, look, this is it. Baby needs." You said, "Baby needs APGAR. Like, you need to assess that," which is good. Again, adrenaline's gone in not too long after your IO. You've made more mention about keeping mum and baby warm. You've given fluid bolus. Tube went in at 13 minutes 50. I guess you've talked a bit about, like, your setup and stuff like that. I don't know if you've had to do any. Have you done any PH?
No.
No.
In theatre, but no. I've not done anything below 8 months.
Sure.
And I definitely haven't done any pre-hospital.
No, yeah. Have you ever tubed any of these, like, on the ground?
No, almost every pediatric rest I've done, I put on the table.
Yeah. And I'm the same. I don't think I've done any of them on the floor.
Yeah.
And I think it's one of those things, like, there's on that mannequin, it's just the whole, we talk it through. But I think even as you're going to do it, you're probably going to look and go, oh, it's going to be real hard.
Yeah.
Let's just move Bub up to something. So, just a consideration.
Yeah.
Early move, potentially, clear some space. If you'd looked around, we would have given you a chair.
Oh, okay.
But that's all right.
Just pull the desk away from Sam.
You kind of you gave your second dose of adrenaline. You've come back and you've done, like, a good assessment of mum, whilst these guys are just kind of cracking on. And then we had, like, it's going to run for 20 minutes. We let you go. So we had another, like, at that point you still had another 3.5 minutes. And I think, I don't know, it almost kind of felt like we were just kind of, like, letting the time run through, like, well, there's nothing, like, it's not a criticism. I'm kind of like, you kind of have done everything at that point. Just think, if this was an actual job on the road, like,
because
at that point, you're ready to
forward momentum, but I couldn't remember. I couldn't remember the situation. We could have.
That's all right. Like, if you,
I keep defaulting back to being on the pod, but
no, that's okay.
Got the same momentum.
Or, hey, look, I'm going to take back over on the tube. Ada, can you get the large vac splint?
Yeah.
And just put the bed in the appropriate spot. We're going to look to move. But, mate, that's very minor. and you kind of at the end verbalise what your thoughts were and your plan and haru and all that kind of stuff. So I think overall a good job. Yeah, you communicate really well, which is it's not just today. That's obviously you communicate really well. You probably have one thing I've noticed. You probably have a tendency to get a bit loud, which I do as well. Yeah. There was one point at the end where it was like, I was like, wow. But
Stop yelling.
but just, that's the same thing. I remember Tom Kelsey, every time he'd help me with the sim, he's like, man, you're intense. And so I used to try, like, something I've just kind of worked on, and it's okay. There's nothing wrong with being intense, nothing wrong being loud. But I think at the point you were loud, I'm like, no, you have everything under control. So just something for you to be mindful of, mate. But that's just little stuff. That's if we manage this job, I'd be stoked if that was your performance, mate. So Jack.
No, look, I agree with everything you've said, Sam. One thing I'll say, which is a really positive piece of feedback, and it's the second time I've seen you do it, and I actually mentioned this to the face-to-face training the other day. You're the first and only person I've seen in a sim obviously get sucked into that vortex of sort of on the verge of cognitive overload. We've all been there. The first one was that asthmatic, and just then you were quite there, but I've never really seen someone so consistently be able to bring themselves back up out of that. It didn't detract from the sim at all. But to see you, as usually such a calm, methodical sort of thinker, get to the stage where it's pretty obvious if you're looking for it that you're going around that vortex, and then whatever you do to get yourself back, keep doing it, because it was fantastic. I think, watch the video, I think you asked the gestational age about 4 million times, but I find myself, when I'm asking the same question, that's usually when I'm like, oh shit, get yourself back. And it's so fantastic to see whatever method you use to get yourself back from that and be able to just, carry on with the sim and still go back to being able to think so clearly and so logically. So give yourself a really big pat on the back, because I've seen it twice, and it's only because I'm looking out for it. It's so good to see. And honestly, I wish I could get myself out of that as easy as you can. So such an important thing with critical thinking, and obviously as the sims get harder, it's really important to get out of there. So wonderful job, really well done with that. Cool. I gave you a hard time. It's only because I'm trying to be funny, but the scene was chaotic. There's like multiple placentas and all these afterbirth and stuff there, but you've very hard highlighted the fact that if you just move the bub away from mum, but you recognise the need for resuscitation really quickly. When I was there holding the kid, you cut the cord within 30 or 40 seconds and really, really quickly, initiated your approach to the resus, which was wonderful. You did a fantastic job to get the neonatal resus squared away in the first 13 or 14 minutes, and then demonstrate a really thorough assessment of the newborn, the other newborn, and then the mother as well. I honestly thought, when you were questioning me here next to the camera, I was like, oh shit, I didn't think we'd get this far in the future. So what an amazing example to, in the 20-minute sim, to actively manage 2 newborns, 1 in arrest, and also do such a thorough assessment of the mother. So fantastic job, Steve. Really good job, man.
Yeah, I was looking at the time, like trying to show Jack, even before you saw it, and I'm like, it's kind of like you've done everything. You've ticked all the stuff you needed to tick, and it's kind of like, well, just let him keep managing. So well done.
Good job, man. That was a tough one, and you did really well. So
thanks.
give yourself a pat on the back.
All right.
Anything from you, fellas?
No, I thought very well done.
Cool. All right.